It starts quietly, a missed signal, a moment of hesitation. You brush it off, stress maybe, too tired, nothing serious. But then it happens again and again. And suddenly, what used to feel natural now feels broken. Erectile dysfunction, or ED, affects over 30 million men in the United States. But for men over 60, especially those living with diabetes, the odds skyrocket. In fact, nearly 70% of men with diabetes will experience ED at some point, according to the American Diabetes Association. Yet few ever talk about it. Why? Because it's uncomfortable. Because masculinity is still too often measured in silence. And because somewhere along the line, we were told that this was just a part of getting older. But let's be clear, erectile dysfunction is not a natural part of aging. It's a signal, a red flag. Your body's way of warning you that something deeper is out of balance. And for men with diabetes, that warning could be tied directly to your blood sugar, your heart health, and even your nervous system. This crisis doesn't just stay in the bedroom. It leaks into your confidence, your relationships, your identity. Many men feel embarrassed. Some pull away from their partners. Others spiral into depression, convinced that they're alone in this struggle. But you are not alone. The truth is, ED is one of the most common and treatable complications of diabetes. The problem is, most men don't even know the two are connected. Worse, many doctors don't bring it up unless the patient does. And let's be honest, how many of us are willing to start that conversation? This silence is dangerous, not just for your sex life, but for your overall health, because ED often shows up before other major warning signs. It can be one of the first visible symptoms of cardiovascular problems, nerve damage, or metabolic disorders. That's why it's so important to talk about it, not with shame, but with urgency. And that's exactly what we're going to do in this video. We're going to uncover the science, the facts, and the solutions behind this silent epidemic. Because the truth is, when it comes to ED and diabetes, knowledge isn't just power, it's freedom. If you've been told that erectile dysfunction is all in your head, it's time to rewrite that script, because the truth is far more physical. Especially for men with diabetes, the root of the problem goes deeper than psychology. It's biological, it's chemical, and it starts with how high blood sugar quietly wreaks havoc on your body. To understand how diabetes causes erectile dysfunction, we need to understand how an erection actually works. When you're sexually aroused, your brain sends signals to the nerves in your penis. These nerves trigger the release of chemicals that relax the blood vessels, allowing blood to flow freely into the erectile tissue. The pressure traps the blood there, and that's what creates and maintains an erection. Now let's introduce diabetes to the picture. Chronically high blood sugar, also known as hyperglycemia, causes two major types of damage that directly interfere with this process. Over time, high blood sugar levels can damage the delicate nerves responsible for sexual response. This condition is called diabetic neuropathy. When the nerves that send arousal signals are impaired, they either send weak signals or none at all. That means your body may no longer respond even if the desire is there. You may feel a loss of sensitivity, a delayed reaction, or worse, nothing at all. Diabetes doesn't just affect nerves, it also damages your blood vessels. High glucose levels cause inflammation and oxidative stress that weaken the endothelial lining of your blood vessels. This makes it harder for them to expand and contract the way they should, and that's a big problem because an erection is all about blood flow. If those vessels are narrowed or stiff, the blood can't get where it needs to go or stay there long enough to sustain an erection. According to the Mayo Clinic, this combination of nerve and vascular damage is the primary reason why men with diabetes are up to 3 times more likely to experience ED than those without it. But it doesn't stop there. Diabetes is also linked to lower testosterone levels, which further reduces libido and energy. Some men even develop insulin resistance in the brain, which affects dopamine, the chemical responsible for motivation and pleasure. In other words, diabetes creates a perfect storm: weakened nerves, poor circulation, and hormonal imbalance. And unless it's treated, the damage only gets worse. Here's the kicker: most of this happens slowly. You may not notice it right away. It might start with fatigue, or less morning wood, or the sense that something's just off. That's why so many men ignore the early signs, until it becomes impossible to ignore. But it's not all bad news. Understanding the science means you're no longer in the dark. You can fight back, and there are proven ways to reduce and even reverse much of this damage. Erectile dysfunction doesn't just show up out of nowhere. It builds quietly, subtly. Long before you find yourself frustrated in the bedroom, your body has already been whispering warnings, hoping you're paying attention. But the truth is, most men miss these early signs, or worse, ignore them. If you're living with diabetes or even pre-diabetes, here are the signals that something deeper may be going wrong, and they don't always start below the belt. Morning wood is a natural part of male health. It's your body's way of confirming that blood flow and nerve function are working properly. When those spontaneous erections begin to disappear, it's not just about age. It could be one of the earliest signs of reduced circulation or nerve dysfunction caused by diabetes. This may seem unrelated to sex, but it's actually one of the strongest indicators of diabetic neuropathy, the same nerve damage that affects sexual performance. If your extremities are losing sensation, your reproductive organs may not be far behind. Poorly controlled blood sugar doesn't just drain your energy, it disrupts your mood, focus, and motivation. That includes your sexual desire. If you're snapping at loved ones, struggling to concentrate, or constantly exhausted, don't chalk it up to getting older. These could all be signs of blood sugar imbalance affecting your entire system. It's normal for libido to fluctuate, but when interest in intimacy drops off completely and stays gone, it could be a sign of low testosterone, insulin resistance, or chronic inflammation. All of these are common in men with diabetes, and all directly impact sexual desire and function. You may still be able to achieve an erection, but can you sustain it? Can you repeat it consistently? If the answer is no, your blood vessels may be struggling to hold the pressure needed for a full erection. And that is often one of the first signs of cardiovascular disease in men. That's right, erectile dysfunction can actually be an early warning sign that your heart is at risk. According to the Cleveland Clinic, ED may appear 3 to 5 years before a major cardiac event. That means the penis is sometimes your body's first alarm system, one that should never be ignored. So if you're experiencing any of these symptoms, even occasionally, it's time to listen. Not with fear, but with curiosity, with care. Because the earlier you recognize the signals, the more power you have to change the outcome. Too many men wait until the damage is done. But you don't have to be one of them. This is your chance to intervene, to get tested, to take control, and to stop thinking of ED as a personal failure. Instead, see it for what it really is: a medical clue. For most men, erectile dysfunction doesn't just affect the body, it hits the heart, the mind, and the spirit, because this isn't just about sex, it's about identity, about intimacy, about how we see ourselves and how we connect with the people we love. When things stop working in the bedroom, many men feel like they've lost a part of themselves, a part they don't know how to talk about. They may feel embarrassed, ashamed, or even broken, and in silence, that shame grows. This emotional toll can be devastating. You start avoiding intimacy, not just physically, but emotionally. A touch on the shoulder becomes uncomfortable. A glance from your partner feels like pressure, and slowly you begin to pull away. Your partner may not understand what's happening. They may feel rejected, unwanted, confused, and because no one is saying the words out loud, assumptions fill the silence. I'm not attractive anymore. He must be cheating. Something's wrong with me. The distance grows. In long-term relationships, ED can create a wall where there used to be connection. And for single men, the fear of intimacy or embarrassment about performance can lead to isolation, dating, avoidance, or depression. Add diabetes to the equation, and the emotional burden becomes even heavier. Many men feel like their bodies have betrayed them. They're managing their sugar, their weight, their medications, and now this, it feels unfair, exhausting, and sometimes hopeless. But here's the truth most men need to hear. You are not less of a man because you're struggling with ED. You are not less worthy of love, intimacy, or happiness. In fact, talking about it, owning it, is one of the most courageous things you can do, because once you stop blaming yourself, you can start taking steps to heal, not just physically, but emotionally. That may mean opening up to your partner, starting a conversation that feels scary, but creates connection. It may mean seeking support from a therapist, a doctor, or even a men's health group. It may just mean forgiving yourself and recognizing that your value isn't measured by performance. You are more than what happens in one part of your body. When couples face ED together, something amazing can happen. Conversations deepen, affection returns, trust is rebuilt. Because real intimacy isn't just about sex, it's about closeness, honesty, and vulnerability. By now, you've seen the connection. Diabetes doesn't just affect your blood sugar. It can interfere with your energy, your confidence, and your ability to perform. But here's the good news. Erectile dysfunction is treatable. And with the right approach, many men living with diabetes can experience major improvements. Let's break it down into two main categories: medical options and natural lifestyle-based strategies. You've heard the names: Viagra, Cialis, Levitra. These drugs work by enhancing the effects of nitric oxide, relaxing muscles in the penis, and increasing blood flow. But for men with diabetes, these medications may not always be enough. Nerve and blood vessel damage can reduce their effectiveness. Still, they're a good starting point. Low testosterone is common in men with type 2 diabetes. If tests confirm low levels, testosterone therapy can help improve libido and energy. Just remember, it's not a fix-all, and it's not for everyone. Vacuum erection devices and penile implants are also options. While more mechanical or invasive, they provide effective solutions for men who don't respond to pills or supplements. But here's the real game changer: lifestyle. Control your blood sugar. That's step one. When your glucose is stable, nerves heal better, circulation improves, and hormonal balance returns. Change your diet, eat more whole foods, fiber, and healthy fats. Cut the processed junk. The Mediterranean diet is proven to improve both diabetes and erectile function. Move your body. Just 30 minutes of walking a day can increase nitric oxide, improve insulin sensitivity, and restore blood flow. Get quality sleep. Reduce stress, meditate, breathe. Cortisol kills testosterone. Rest brings it back. Consider science-backed supplements like L-arginine, Panax, ginseng, zinc, and vitamin D. Always check with your doctor before starting anything new, because the truth is, no one solution works alone. But together, these changes can create a transformation that medicine alone never could. Let's pause for a moment and ask the real question. What does it mean to feel like yourself again? For many men, the answer isn't just about sex. It's about confidence, energy, the freedom to be close to someone without fear, the feeling of waking up in a body that still works for you, not against you. And that's possible, no matter your age, no matter how long you've been dealing with diabetes or ED. Your body wants to heal. It's wired for recovery. Every small action you take sends a message that you're choosing life again. Maybe you haven't exercised in years. Maybe you're embarrassed to talk about this. That's okay. Start with one change. Drink more water. Go for a walk. Call your doctor. Each time you show up for yourself, you prove something. You're not giving up. You're still worthy of connection, of intimacy, of joy. You're not alone. Men around the world are reclaiming their health, their confidence, their relationships, and so can you. This isn't about going back in time, it's about building a better future. Now let's bring it home. ED and diabetes are two of the most common, most connected, and most misunderstood health issues for men over 60, but understanding the connection gives you power. Power to change, power to heal, power to take back what's yours. So here's what we want you to do. Talk to your doctor. Ask the hard questions. Make one small change. Today, speak up. You're not the only one. And subscribe to Second Sunrise for more guidance on reclaiming your health and living fully after 60. Leave a comment. Share your story. Let's build a space where men help men, where truth replaces shame and action. Replaces fear. You are not your diagnosis. You are not your worst day. You are a man who still has a future to fight for. And at Second Sunrise, we'll walk with you every step of the way, because it's never too late to rise again.